Yes, sir, Mr. Chairman.
All right, great. You've heard the ground rules. People have read the materials, and you're welcome to make an opening comment, and then we'll take questions. It's 4:19 now, and we'll go for 15 minutes to 4:34. Go ahead.
Thank you very much, Mr. Chairman and members of the Budget and Finance Committee. Again, my name is Steve Bland, and I'm CEO for the Nashville Metropolitan Transit Authority, doing business as WeGo Public Transit. We also have logged into the call several of our staff and board members from the MTA board who will help me address any questions that the committee might have. And again, in the interest of time and to maximize the amount of time for questions, I'll try to keep my opening remarks short. First, I'd be remiss if I didn't acknowledge and thank the 720 employees of WeGo Public Transit for their heroic efforts over the past 2 months to sustain core transit services in light of the COVID-19 pandemic. Despite the closure of schools and colleges and the shutdown of much of our local economy, between 10 and 12,000 people every day are still undertaking their essential trips on WeGo Public Transit. Second, I'd also like to acknowledge the new reality that we're all working under. COVID-19 has certainly fundamentally altered the way that we do business at WeGo, and we expect many of those changes to be permanent long after all of the stay-at-home restrictions are lifted. Through our partnership with the Metro Nashville Department of Public Health, we've significantly revised our operating and maintenance practices to enhance the riding environment for our employees and our customers, and we work closely with our union, ATU Local 1235, to very quickly modify operating schedules and employee work schedules and operating practices to minimize the exposure of our employees and customers to harm, and also to provide paid time off for our most vulnerable employees and those who have been required to be in quarantine due to a known exposure to positive cases. These new requirements, of course, have added significant costs, which we continue to track. Some of these costs we expect will dissipate over time. Frankly, we expect some to remain our new normal permanently. One of the most significant costs that we've been experiencing is the cost of our lost revenue, both as a result of our declining ridership and because we have relaxed fare collection standards to promote both social distancing and having less human contact with the surfaces on our vehicles. Overall, we're projecting revenue losses in the neighborhood of $14 to $16 million going through next fiscal year and into fiscal year 21-22. Of course, part of the new reality, at least in the short term, is also the severe fiscal constraints that Metro is under and the extremely difficult choices that the mayor and this council need to make. As such, we were extremely pleased with the passage of the CARES Act by the federal government, which will provide the MTA with a temporary infusion of federal funds to help alleviate these shortfalls. With respect to public transit, the CARES Act will make $55 million available to the MTA to offset reduced operating income, increased expenses related to COVID-19 response, undertaking several capital projects that will improve both our resilience and our ability to respond to future health emergencies, and will also afford us the opportunity to relieve some of Metro's funding responsibility for the upcoming fiscal year. As such, the MTA and the RTA can absolutely sustain the mayor's recommended budget cut of $22.3 million, 44% of last year's budget allocation for transit, through the application of federal CARES Act funding. And we can do so without any negative impact to customers or employees. Current service levels will remain as is. Current fare levels can remain constant. Unfortunately, we will not be in a position at this time to improve services as we had originally proposed through our Better Bus plan and as submitted in the original pre-COVID request to Metro, but certainly sustaining our key public services right now in this time is our primary goal and objective. So with that, Mr. Chairman, I thank you for the opportunity for us to speak with the committee today, and I look forward to the committee's questions.
Thank you. And two things before we get going here. One is Mr. Cooper here pointed out that I misspoke, and we had allocated a half hour, so that would be till 4:49. And then secondly, I want to make sure that really make a record for next year's budget process to make sure we all understand the $22 million that y'all are going to use from the CARES Act to make ends meet. Can you describe what the dynamics at play that are going to make it that when we fast forward a year and that one-time money is not around anymore, Metro is going to have to pick up that $22 million again. Can you describe what's at play there?
Sure. First of all, with respect to, and there were a lot of provisions in the CARES Act generally and certainly for various governmental entities. For the public transportation piece, the overall bill distributed quite a few $1 billion to transit agencies around the country based on pre-existing formulas. This is one-time money. Frankly, the CARES Act, the total value of the CARES Act was about 3 times our average annual appropriation of federal funds. So it was really unprecedented at that level in both its volume, the sheer number of dollars, as well as the flexibility. Typically, we're only able to use federal funding for a percentage of our capital project expenses, so projects, construction, capital equipment, what have you. We're not allowed to use it for operations. In the case of the CARES Act, they waived these requirements and essentially made it available for any use that the transit agency might have. But I can literally say in 30 plus years, I'll leave it at 30, in the business, I've never seen a funding package from the federal government for transit that had this magnitude or this level of flexibility. So I think we very much need to treat it as a one-time resource that will be non-repeating. And best description I heard when I was talking to some of our federal funding partners about, what the intent of the act was. The goal of the United States Department of Transportation in providing these funds is to try to assure to the maximum extent possible that transit agencies and transit riders specifically exit the pandemic in the same condition that we entered it, that we're neither diminished nor enhanced.
Thank you. Councilman Droffel is first in line.
Thank you, Mr. Bland. Some of my staff use you and really you take great care of them. Question, the ridership, at least from a distance, appears down, and maybe if you could update us what the ridership is. But sort of an obvious question, it's been asked before, and I'm just curious, is there an opportunity directionally to use smaller buses, smaller vans, which would save on gas and really probably be more maneuverable? It just seems sort of a logic opportunity. I know you couldn't change the buses out quickly, but if you could comment on that, I'd appreciate it.
Thank you, Mr. Droffel. Appreciate the question. Actually, we're running into the situation now because of the social distancing guidelines where we wish we had more of our huge buses, our articulated buses. Overall, with respect to ridership, right now, overall MTA ridership is down about 60%. But it's kind of like anything where you're dealing with averages. Some of our routes are down by considerably more. Some are down by considerably less. And some of our busiest routes, for instance, Gallatin Road, Murfreesboro Pike, the Bordeaux route, the Dickerson Pike route, Nolensville, really haven't lost as much ride. They're significantly down, but they can still be quite crowded, particularly during certain times of day. Fuel costs, even though they're significant, are a relatively small percentage of our budget. So the fuel savings generally isn't all that significant when you compare, say, our body-on-chassis buses, like what you see in Access, or some of our crosstown and circulator routes, compared to the larger coaches. And even under normal circumstances, when we're dealing with things like peak loads, whether that be peak commute passenger loads or school trips, we carry a lot of Metro Nashville public school students. Having those larger coaches is really important. With that said, we have been trying to look at each route family in our system and pair the correct vehicle. So you are seeing more of the smaller buses on our crosstowns and our neighborhood circulators. You'll see more of the articulated buses on those high ridership arterial services like Gallatin and Murfreesboro, and then the 40-foot bus on the local routes that tend to have kind of ups and downs in ridership by shift.
Thank you very much. I appreciate it.
Thank you, Councilmember Sledge.
Thank you, Chair. I wanted to get a little bit more into the capital improvements that you alluded to, Director Bland, and I think were outlined in the mayor's letter to us as well, but it seemed like they might be actually outside the money that y'all received specifically. Could you talk a little bit about those potential capital improvements?
Councilman, are you speaking specifically to the capital projects in our CARES Act applications or the broader capital plan?
The CARES Act application.
Sure. They fall into a few different categories. One category has to do with essentially retrofitting our buses to make them, for lack of a better word, more pandemic proof. So it's things like what I would refer to as an operator barrier that, for lack of, in the nomenclature, I guess you'd call it a sneeze guard that kind of separates the bus operator from the customers. We're experimenting with a few different designs. It's replacing a lot of our seating material with an easier to clean, bacterial resistant material that's easier to disinfect. It's acquiring new shop and service lane equipment that we can enhance our overnight servicing practices, both in our bus garages for our vehicles, as well as at WeGo Central for the facility itself. It's supporting some upgrades, and I was able to listen in on a lot of Director Durbin's testimony for ITS. It's supporting upgrades in our automated data processing and hardware software systems to support more remote operations, which will enhance our overall resilience, not just for instance, administrative employees, but things like our operations control functions. It's doing some additional upgrades to the WeGo Central facility to make that facility easier to clean, easier to sanitize. Upgrading some of our facilities with particularly our Nestor bus operating facility, focusing on service lane throughput. As I mentioned in my opening remarks, we've been very thankful for the very open partnership with Metro Public Health, who made a lot of recommendations that we've adopted in our cleaning and sanitizing processes. One of the challenges that's leading to increased cost is right now they're very labor intensive. So a lot of what we're looking to do is trying to have automation try to help us with some of those types of efforts.
Anything else, Councilmember Sledge?
No, that was thorough. Thank you.
Thank you. Councilmember Suara. Councilmember Suara?
Thank you, Chair. Thank you. I'm muting myself. Can you hear me?
Yes, go ahead.
Thank you, Mr. And for the detailed presentation, and I want to what everyone is saying about what MTA is doing and all that is going into it. My look at financials, I frame this standard you want Metro employees. I understand that. I also understand that the program from Metro is being talked over the and I give it more than a week. I've been in fact at the we're giving less because of that. I understand that. But looking at the financials, we project a 4 billion, but when I look at a 4 billion increase, 3 million of that is in personnel. And so I was just trying to, is that increase in personnel? Are we increasing services, even though we will get the revenue from it? Or just trying to reconcile those numbers?
Thank you, Council Lady. And you were breaking up a little bit, so I'll repeat what I think the question was. And if I got it wrong, I would appreciate if you could repeat it for me. I think the question had to do with the increase in the personal services line in the budget, and whether that had to do with increasing staffing levels or increasing service levels or what have you. The background on that is there are additional positions that would be included in this budget, about a dozen. Most of those would be enhancing our custodial and cleaning staff so that we're able to sustain a lot of the hygienic processes that are going in place. One of the things that's occurring right now, as an example of this, is so we have essentially closed the public waiting areas and the public restrooms at our WeGo Central facility and have redeployed custodial staff to essentially disinfect high-touch surfaces on our buses between trips as they pull into Central. We're able to do this, and they are able to really saturate those buses, A, because of the closure of those other facilities, but B, because we're really right now operating a reduced service level. So as we start kind of ramping service back up, which we will begin on June 1st, that staffing increase will help us maintain those hygienic practices. The other staffing increases are related to particularly our new fare collection system, our automated fare collection system and smart card system. We're working, in fact, very closely with Director Durbin's department over at Metro ITS to upgrade that system. It will essentially be a touchless system, which will certainly enhance our ability to collect fares coming out of the immediate COVID-19 process. But there is a lot more componentry, for lack of a better word, both on board the bus and at our fixed facilities. So there will be an additional maintenance required associated with that. Beyond those staffing increases, most of the budgetary increases related to increases in wage levels as negotiated in our collective bargaining agreement with ATU Local 1235.
Thank you.
Thanks, Councilmember. Councilman Bradford, I thought you had a question, but your hand's not up. Anything you want to ask?
No, my hand is not up. I did put a question in the QA though.
Ah, all right. Thank you. All right. I don't see any other hands up, but we've got a little bit of time. So can you talk to us, just give us an update on the North Nashville Transit Center and how plans are going for that?
Sure. It's a project we're very anxious to get in the ground and not just on paper. And we've been working very closely, particularly with Faye DeMassimo, but the mayor's office, in fact, in resubmitting another federal application to expand the scope of that project. But in fact, we were meeting on that earlier today. We're advancing. We're very close to completing the property negotiations, and we are doing due diligence activities like surveying, geotechnical work on the site. We have a designer engaged. And in fact, and I know that Gail Carr-Williams, our board chair, will actually be really kind of heading up our public engagement effort in North Nashville as we initiate design on that. So we're kind of hopeful that the timing comes together. We're able to do maybe a little bit more public, face-to-face public engagement as we program that facility. So we've received, so far we have a total of about $4.5 million in hand for that project. In fact, just about a month ago, we received a notice of award of $2.7 million from TDOT under their Improve Act Transit Capital Funding Program. So it continues to advance, not as quickly as I would probably like, but we think it's going to be a major asset for our system overall. It will essentially be the intersecting point immediately for 5 bus routes. And if we're able to eventually enact the Better Bus program, a 6th route, a crosstown route on Trinity Lane, would also connect at that facility. So we think it'll be a major asset for our system, but also, for the surrounding neighborhood of North Nashville and the Clarksville Pike area.
Thank you. And Councilmember Henderson has her hand up. Go ahead.
Thank you, Chair Mezquez, and thank you, Director Bland. I was very glad to hear about the CARES Act money and the ability to put that to operational. And so thank you for sharing about that on the front end. I also wanted to understand down kind of a little more granular level as we look at the CARES Act and the intersection of that kind of in the public works space. Some of the foundational work that you all have been doing in partnership with planning and public works about safe crossings and, how that kind of fits in the scope of COVID and kind of, getting people to those buses and giving them a place, safe place to stand and wait wait for the bus, potentially enter the bus from the back, not the front. And if at all, I recognize that, the intent is not to be big on the capital side in this space, but stuff that is just kind of supportive and more low cost in that realm. Can you share with me, as you discuss with the mayor's office, if that is a consideration or something you're looking at? Thank you.
Sure, absolutely, and I appreciate the question, Councilor Henderson. And we are working closely with Mayor's Office, Public Works, Metro Planning on identifying those highest priority high boarding location stops, particularly those where we see inordinate numbers of accidents, particularly pedestrian accidents. Not directly related to your question, but a piece of good news I will report. We officially started in the ground, people with hard hats construction on the upgrades to the stops in the Nolensville Pike corridor last week. So you will see crews in that corridor actively working to upgrade 18 of our stops in that very busy corridor with exactly the type of enhancements that you're talking about. And certainly we have made the case, and the federal government is buying the idea that if we can improve stops, the ability to access them, as you say, expand the waiting areas so people aren't crammed, particularly at our busier stops, into a very tight location, that does enhance, the hygienic activity and the safety activity. So it's certainly a conversation we'll continue to have with the mayor's office and with Ms. DeMassimo as the mayor rolls out his transportation plan, hopefully in the not too distant future.
Anything else, council member?
No, sir. Thank you.
All right. So there's nobody else in the queue. Mr. Bland, like other departments who've been before us, really want to make sure you know that speaking on behalf of the council, we understand that a lot of your folks are out forward-facing to the public every single day, all day, and there's extra risk for them and their families from that, and we appreciate y'all getting the job done for transit for us. Thank you.
Thank you, Mr. Chair and members of the committee, and if there are any questions subsequent to the hearing, we'll be happy to respond to the council.
Thank you very much.